No, it's not.
Jessica or Jenna, can you guys hear me? Can you like a thumbs up if you can hear me okay?
Yes, I can hear you. It's just not super clear. I hear the room more than I hear you.
You can hear me?
Yes.
Great. We'll be getting started in just a minute.
You're lucky. So I'll grab that chair. Okay. That was not the first thing on your mind. Okay. She was today's counselor. But it was.
All right, everybody, let's get started. We are going to go around and do introductions. We've got a full house today, which I'm super excited about. Didn't realize on a Tuesday, I thought, yeah, people might not come. So great. So we do want to keep introductions a little bit brief, but what we're going to do is we're going to go around and say your name, the agency you work for, your affiliation to drug prevention, and if there is anything that you have done recently that you want to promote connected to drug prevention or anything that your organization is doing, now is the time to do it. That being said, I have a couple of announcements. Are you in representation of Nancy Smallwood right here? Okay. So Nancy should be here to present more details about this because I'm not going to do it justice. But we did, you know how they kind of talking about we've been really worried our funding is going to be gone and the council will be over and we're really freaked out. But I think that we did get the grant, the opioid funding summit grant. So that does mean that we will be able to sustain for another 2 years. And we're super excited about it. We just don't really know the details. It's very ominous. Like, you've got the money, but we don't know the policy and the procedures on how to get it. So we're a little bit, Nancy was gonna explain a little bit more, probably say it better than I just did. But so that's really exciting. We're able to sustain for the next 2 years. The other thing is Harmony Grove Baptist Church is having their annual drug event. It's a wonderful event. I sent out the flyer in the email. So if you can go to that, but you do just ask for an RSVP because the guys come out at the church and they make breakfast for everybody. And it's really great. We always have some members show up to support that. The other thing is, so the Walk for Recovery, you guys all know it, love it. You're there, you support it, and we need to start planning it, and I need help. So I need to gather the committee. If anybody in here is interested in helping me to set up the Walk for Recovery in April, right now it's, I believe, April 16th is the date, and I'll have a flyer out and get way more official than this, but right now I'm really just looking for people to help me set up, clean up, find members to help me, Adam, Susan, you guys, so So if you are interested in helping that, we can use all the help that we can get, so please come find me after the meeting, let me know if you could do that. Then the most current and urgent, important thing, is this, the drug summit. If you don't have one in front of you, does everybody have one in front of you? It's important that you have one in front of you. Not everybody does. So this is going to be our next council meeting. So we will not have first Wednesday of the month. It will be, please come to this. And we're doing it at UNG, thank you, Katie, this year, instead of at Full Circle. And the panel's gonna be a little bit different. We've invited, Drew's helped out inviting some principals, and they're really gonna be telling us what they're seeing in the schools. We're really excited to kind of hear what they're seeing, what they're doing about it, and then hopefully we're gonna have some responses to that, or resources in the community. And the goal is to educate the public. The goal is to promote, awareness. Really, if there's anybody that that would be able to come out and support just drug prevention and awareness in our community, and not just kind of walking around like the issues we've had, and parents don't know what's going on, and teachers, everybody's kind of lost in how to respond to this vaping epidemic. That's what we're going to be talking about. So please, please, please invite who you can to this. It's at a new venue, so we really want to try and get a good turnout. There's a QR code and a website to RSVP. So I think, just saying, this is really important. Okay, get the word out for this. And then in the email, I'm going to send this. If you could post it on your social media or anywhere that you're willing to post it, we would also really greatly appreciate that. So that's all I got. I
Just
swear.
one quick thing.
Yes.
Cindy Knowles wanted to be here so bad, but her niece is having a baby and she's at the hospital waiting for that baby to be born. She wanted to be here so bad.
Yes. So we do miss Cindy. So that being said, I'm Rachel Keenan. If you guys didn't know, that's my name. I do the drug council here. And I'm gonna start here and then we'll go this way for introductions.
Hi, I'm Alicia. I'm the project coordinator with Rachel for the council, so helping out with events, and we'll probably be getting some emails and stuff like that from me, so.
So be nice to her.
Emily Ennis, I'm a substance use counselor at the Insight program, and I'm currently over at the Academy and Forsyth Academy and Gateway Academy, working with the students there for drug prevention.
Hi, I'm Angela Hurt. I'm assistant principal at North Forsyth High School. I'm here just to come as much as I possibly can, just to help to support the work around what these ladies do in our school with drug prevention and supporting our students who are struggling.
I'm Amy Dykes. I'm the student support coordinator at North Forsyth High School and work closely with Ainsley at our school.
I'm Ainsley Miller. I'm a substance use counselor for the Insight program. And I also go into North Forsyth High School and work with the students there on substance prevention.
I'm Miriam Shellcat. I've worked in recovery for the last 10 years. I'm an addiction counselor, and I'm new to Forsyth County, I used to live in Union County.
I'm Manju Bakka, working as a team lead for Georgia Department of Corrections, and I came here for my daughter.
My name is Manasvi Konamudi, and I'm a freshman. I go to South Forsyth High School. I just started distributing marketing kits to schools, hospitals, and businesses.
So I'm Maureen Bixler. I'm a licensed clinical social worker, and I'm the owner of Live Life Counseling. And then we also opened an intensive outpatient program for adults and for children for substance abuse and trauma. So that's called Live Life Level 2.
I'm Abigail Bogan. I'm with Forsyth County Community Connections. I am the drop-in case manager for our new resource center. We serve unaccompanied homeless youth ages 18 to 24.
Allison Mayfield. I'm the executive director here at United Way.
Welcome.
Hey, I'm Drew. I'm the principal of the Academies of Creative Education. So that includes virtual, that includes Forsyth Academy, and then Gateway Academy, which is where kids, when they get invited to leave their school for a little period of time, I'm the place that they come. Emily works with me in that building, and then we also work very closely with the group at North. Part of the grant, I think, that I'll talk about today is a potential expansion of all of these things. Which really started with the work of Cindy Mills and Rachel and all of these other folks in collaboration with the school system. I'm going to talk for 30 seconds, I guess. This doesn't exist in any other school system in the state in terms of where this is. I'm all over the place. We're gonna host a alternative ed summit at the end of January, January 24th. And bringing in the drug counselors is one of the things because people are completely startled, shocked, blown away by the idea that this is something that our community and our county are providing. Statesboro, Bullitt County came to visit earlier in the year in association with that. They have now started some drug counseling in their alternative school because of the level of the problem that they had. So just the work that's happening here and those other things in collaboration is helping people be aware and then also helping find support and recognizing that school can be a juncture where that can.
Katie Lamberson, I'm the Assistant Dean of the College of Health Sciences and Professions at University of Georgia. And that's the college that houses our counseling program, which is has the only accredited Masters of Counseling and Addiction Counseling in the state of Georgia. We're also part of the grant that Rachel mentioned. We're hoping to collaborate with Drew and the council. We are restricted in how many students we can send into our program based on accreditation standards of faculty. So now we can increase our faculty due to that grant, which means we can bring in more students, which means we can put students in the schools.
I'm Dana Bryant. I'm a former middle school teacher, and I'm here because I lost a daughter to heroin overdose at 15.
I'm Carl Lavard. I'm really here visiting, and this is my wife Amy. We've been involved with different drug support groups, and really here to support also the big group there. So, so my first time in, so drag me along.
Welcome, happy to have you.
I guess more than anything, we're longtime residents of the county and parents of 3 kids, one of whom has had a long battle with substance abuse, and just very grateful for the support in the community and excited to hear from Julie and Pacer this morning.
Susan Tanner, I'm the stepmom to 2 grown kids with addiction, and I mentor in about 4 different schools in Forsyth County, and I'm in the moms group with these 2.
I'm Julie Cordry. I'm a mom who has a child battling addiction. I'm also a Forsyth County employee. I'm a speech therapist, and we recently took over Prodigal Child Ministries, and that's just like a support system for parents, and we're going to get to talk about this.
And I'm Pacer Cordry, and I'll share more in a couple minutes.
Yeah.
Okay, let's start over here.
Yeah, I'm Justin Combs. I'm the pastor, Bethel View United Methodist. I'm here at the invite of Amy and Carl. But I also, I know that the church is not a place that's immune from people battling addiction, and that we should be a place that is helping to support and nurture those that are going through the process. So, so we're glad to be here today and see how things are going here.
Great, welcome. Nancy, I really hyped you up to explain this grant, so.
I'm Nancy Smallwood, I'm grants manager for Forsyth County. We together the grant for the drug treatment and the drug counseling with the Department of Health or Behavioral Health, and we put everyone together with partnership with schools, with partnership with the university, with partnership with drug counseling and the drug awareness committee. So we got everyone's needs and wrote the grant and asked for the money with a lot of lobbying by Cindy Mills. I don't know if she's online or not, but we got all of Cindy's money. So we were very blessed and we're very excited. So we are hoping to manage all of this together. So yeah, we're gonna have an onboarding meeting with everyone and start. And hopefully accomplish all the goals that we said that we were going to do. So we're very excited to support the community. I mean, that's what the county is here to do. So, we're excited.
We appreciate you. Take Casey.
Hi, and I'm Belinda Contreras. I'm the healthcare program consultant at the Forsyth County Health Department. I work a lot out in the community, and that's my passion to work on public health. I've been doing public health for 10 years.
Good morning, Lindsay Simpson, Student Support Facilitator for Forsyth County Schools.
Hey, I'm Adam Miller. I work in drug and alcohol treatment. I have for the last 7 years in different facilities. I sit on the board for the council, on the board for Most High Media, and I do some counseling at a Pastor Buddy's Christian, excuse me, Christian Counseling Center here in Flat. And I'm contracted from Cherokee County to do counseling for family treatment court.
I am Carol Branch. I'm the president of About Face USA. We are a veteran-focused nonprofit, and we have a veteran resource and community center at Tri-County Plaza, right behind Harbor Freight. You're welcome to come and see our indoor aeroponic farm. We are open to the public, even though our focus is on veterans.
All right, we're gonna do quick introductions of the Zoom members. Danielle, you wanna start us off?
Yes, hi, Danielle Rietta. I'm a licensed professional counselor with Avita Community Partners, been there well over 8 years, with the council, I think since 2018 or 19, and I had a couple years break in the pandemic kind of, but good to be here. I do work with kids and adults, and of course, addiction's a big part of what we see. So we have a couple groups, outpatient groups, to support people if they need that.
Awesome.
And that's it.
Miss Jenna? Jenna, I think you're muted if you're talking.
Sorry, I was trying to find the button. Good morning, Jenna.
Man.
Oh, sorry, what was that?
It's cutting out.
Sorry. Well, I'm here.
Hey Jenna, welcome. I'm Casa is my guest because of your title. Jessica?
Hi, can you hear me?
Yes.
Hey, my name is Jessica. Sorry, my camera's not up. My name is Jessica. I work with Mount Sinai Wellness Center. We are a detox and residential treatment facility in Dahlonega for co-occurring disorders.
Okay, great. Glad to have you here. And Miss Chelsea.
I'm Chelsea Clark. I'm the grant administrator for Forsyth County.
Yes, thank you, Chelsea, for all you do as well. So as you guys can see, we have members from all facets of the community. And just a reminder, the point of us all getting together again is after the council meeting for us to shake hands, work with each other, see if we can support each other in any other way. So that being said, we're going to get started before we have our main speakers come up. Manasvi is part of our youth committee. You guys don't get to see and hear them a lot because this meeting's really early and they have school, right? So, but we actually have a whole big youth committee who's doing projects in our community at all times, and they're great. So I wanted them to come in and just tell you guys what they're doing. So Manasvi has 5 minutes and she is gonna come up and we're gonna be nice to her and give her a warm welcome. We're excited. I hope it works.
Thank you.
So as y'all know, my name is Manasvi Kamudi and I'm a freshman at South Forsyth High School. Today, I'm going to be talking about the interplay between mental health and the opioid crisis. And this kind of builds up to what I do as well with Narcan kids. So understanding the connection between mental health and the opioid crisis is crucial for developing effective prevention and treatment strategies, as this is not just a public health issue, it's also a mental health crisis. So to actually understand the crisis, we have to know what the definition is. The opioid crisis is referred to as the widespread misuse of both prescription and non-prescription opioid drugs. This can lead to dependence, addiction, overdose, and even death. So since the late 1990s especially, this is when opioid prescriptions have skyrocketed, leading to an epidemic that has claimed the lives of over 600,000 people in the United States alone, just in the past 24 years. So when it comes to the mental health connection, many individuals struggling with this opioid addiction are also experiencing mental health disorders. According to the National Institute on Drug Abuse, nearly 50% of all people with substance use disorders also have some type of mental health disorder. People also often turn towards opioids as a way to cope with their emotional pain and mental health challenges. Even though opioids can provide temporary relief, this can quickly spiral into dependence and addiction. Conversely, opioid addiction can also aggravate mental health issues. So because of this, you can feel more increased anxiety, depression, feelings of isolation, and this can also make it even harder for these individuals to seek the help that they need. So what will we do? We came up with 3 different solutions that can address this crisis. The power of youth. Youth leadership plays an important role in wearing awareness about drug prevention. As a young leader, I aim to bring in fresh ideas and connect with my peers in meaningful ways. By organizing school workshops, sharing information, and supporting programs, I strive to help create positive change. Together, we can all help the FCDAC work towards a safer and a healthier Forsyth County. So, education and awareness. I believe that educating healthcare providers, patients, and communities about the signs of mental health and the risks of opioid misuse is critical to fostering early intervention. Awareness programs, workshops, training sessions, and social media campaigns are all ways that people can help and help individuals recognize these warning signs and access resources promptly. So this can ultimately reduce both challenges on public health. When it comes to community support, I believe we should be building a robust community support system, which can provide individuals with the access they need to actually get like the treatment and then the support that they need from others. This can also help maintain long-term sobriety and also increase mental well-being of all the individuals of Forsyth County. So what I'm doing. Narcan is a life-saving tool that reverses opioid overdoses and gives individuals a second chance. By distributing these Narcan kits and offering training, we empower communities to respond in emergencies. I'm collaborating with Rachel, who actually helped me get all the things that I need. So I've also been distributing a couple of these to my middle school, which I've done. I'm trying to get out to Northside Hospital to give it out to them. And I'm trying to reach out to other places, maybe like my high school and other high schools in the county itself, to see what we can do. Together, we can expand this initiative to reach more people. So not only for Forsyth County, but maybe even the entire state of Georgia. And ensure that every community itself is like prepared to save lives. So opioid and mental health issues are deeply intertwined. By understanding and addressing this crisis, we can create more effective solutions that can save more lives. We all have a role to play, whether it's advocating for integrated health approaches or supporting local mental health initiatives, or just being aware of the struggles that people around us are facing. Together, we can make a
difference. Yeah. Okay. So the thing we always talk about is youth talking to youth is the most effective, right? And that's why we really do. If you know anybody who's young who wants to help out, she's going to go out and be able to say all of this to other youth members and community members. And that's why we really want to encourage any youth member to join our committee and help us out any way that we can, because they really are the most effective. So that being said, Alicia, is their presentation already? It is. Can you switch it over? Okay, so we have also learned that the religious community is really, really, really important in Forsyth County. If you didn't know that, it's pretty big. So we've been kind of trying to work closer with the churches and the religious community. And honestly, last year, we just didn't make too much momentum. We worked so closely with the school that it wasn't necessarily just our primary focus. So today, we are very excited, again, welcome here, because we do want to be able to work and collaborate as much as we can with the religious community, because like you said, it all works together. So our speakers today, Julie and Pacer Cordry, come on up. Let's give them a warm round of applause. To talk about their experience with prevention and intervention in their community.
Yeah, thank you. First of all, thank you for being here. I know that we can't, it's very difficult to change it as an individual, but as a group, church, schools, support systems, counselors, all those things I think about, have played a big part in our lives. Our child, I think started when he was about 14, he's 23 now. There was probably a good year that there was no sleep. And you know that feeling of being sick to your stomach, of lack of sleep. That's the feeling I described to have a child with addiction at all times. Because it's always on your mind. And it started, before we get into the ministry part, I'm going to give you a quick picture of how we got here. I'm in law enforcement. I'm a police officer. Julie works for the school system. I'll let her introduce herself in a second. And we had no clue. We didn't know what to do. We didn't know where to turn. I didn't even know anybody really. We both grew up in a household that wasn't familiar with addiction. So to have a child that's using, we couldn't even quite figure out what he was using at the time. It's kind of a spice or synthetic, and then the alcohol and the opioids and whatever was available, he found a way to get. And it disrupted our family so bad that I always say this because it's interesting. We also have a daughter, and that's like an afterthought.
Oh, yeah.
And that always hurts to say. It's like, oh yeah, we have a daughter. But we spent so much time trying to help my son, right? Great kid. We had a great relationship. And so to be in law enforcement, be on the other side of it, and to go from that side, you would think I know a little bit about addiction. Well, I did. I knew how to talk to them. I knew where to take them when they did something bad, but I didn't know how to help my son. And as a parent, we felt like we didn't know where to turn.
Yeah.
So I guess it would have been about 6 years ago, we started Sunrise Parent Retreat. And that was a way I'll let Julie explain that in a second, but it was a way for us to give back, right? If you've been around addiction or been around a tragedy and God's allowed you to go through that, you're missing an opportunity if you've gone through it and been out the other side of it to help somebody else that's been through it. We wish we would have had somebody that was able to reach out to us and say, this is, let me guide you down the road, right? This is maybe what you should look at. And God gave us a vision for Sunrise Parent Retreat. And I say that because now it's Prodigal Child Ministries. And I'll let Julie explain how we got there.
Sure. So, like you said, we've been, going through this.
I'll let you click. I'll run the clicker.
Okay. I don't have to put that yet, but that's okay. All right. So like you said, this has been like a 8-year journey that we've been on. And the way the way Sunrise Parent Retreat came about is I was sitting in a support group for parents. I don't know if you've heard of PRN. It meets on Thursday nights. Kristen Banks started it along with Sherry Aljaluni. But I was sitting there and there was a dad that goes, I just need to get away. And God just stirred something in my soul. And I was like, yes, we all need to get away. This is like too much. It's chaotic. So we just started talking about it. And part of that vision was it's got to be free because these parents are refinancing their houses. They're paying for legal fees, rehabs, like they don't have money. So we just started talking about it in the community and raising funds, and people started giving us money. And so we fully funded 5 retreats for parents. And we had them at different locations, and it was just a way for them to see, look, you are not alone. We're all normal people, because you have these visions of what it means, but and there was this intense shame, like he talks about not knowing like where to get help. I didn't want to tell anyone about it. I mean, I work for the school system, and here I'm thinking, oh my gosh, if my coworkers know about this, like what are they going to think of me as an employee when I can't keep track or take care or control my child? So I had this intense shame that I no longer have. But so anyway, we started Sunrise Parent Retreat, and then this past summer we got a call from Fair and John Brocard. They are the founders of Prodigal Child Ministries, and it has been in effect for this is the 25th year this ministry has been going on. And They go to Johnson Prairie Baptist Church, so that's kind of the hub of where it all started. But they called and said, hey, do you know anyone who might want to take over this ministry? We would like to retire. And I thought, well, I know lots of parents. Let me think about it. And they're like, well, what about you guys? And I was like, no. I mean, he's a police officer. I work full time. We have the Sunrise Parent Retreat. We don't have time to do that.
Yeah, it was interesting because when I looked at the ministries, I'm like, they're the same. And it was such a blessing to be able to take it over and to transition so smoothly.
Yeah, it was kind of crazy because my first thought was no, but then we desire to glorify God. Like that's what we are here for. And so I thought, okay, well, maybe this is our chance to do that. So anyway, August 1st, we took it over. And so we just want to kind of tell you all about it. So really the heart of this ministry, we just want to support parents. Parents of any prodigal. So any child that's going through, turned away from any way they were raised.
You brought up a great point. About 50% have mental illness. So the other half of the ministry focuses on that 50%, really to reach out to them and give them a resource where to turn.
Yeah. It's a scary road to walk. I mean, our child not only has addiction issues, but also has a mental health condition. He is bipolar. So, I mean, it's a lot. And so just having other people around you that understand and that can help guide you is a beautiful thing. So you can go to the next one if you want. Okay, so what do we offer? So right now there are support groups, a lot of support groups at Johnson Prairie Baptist Church, because that's where the thing was founded. So the second and fourth Thursday of every month, there's Parents of Prodigals group. And Gary and Jody Godfrey lead this group. And what they do is they invite a parent in to come and share their story of survival. So they're talking about how they are making it through this journey, going through whatever they're going through with their child. The opposite night, they're going through a book called The Prodigal Parent Process by Douglas Weiss. And our Monday night Bible study just did this book, and it is incredibly powerful, very freeing for a parent to find that, you didn't cause this, that it's really about your child's journey with God. So it's a beautiful study, a beautiful book. So that is the second and the fourth Thursday of the month. And then one of the moms, Laura Hutchins, lost her son. I think it was last year sometime. She just had the 1-year anniversary. So anyway, she felt called. She wanted to step up and just lead Hope After Loss group. So the first and third Thursdays, she leads that Hope After Loss group at Johnson Prairie Baptist. Her and another lady named Courtney Rue. And you would think it might be kind of a hard group to go to. This woman is so full of faith that I want to go to their group. I mean, even though I haven't lost my child, she has just this beautiful way about bringing hope to parents. So it's an incredible, incredible group. The third Friday of each month, they have a mom's prayer group that meets at the Johnson Prairie Baptist Church Cafe. I don't know if you've ever been to this church. We've only been a few times. It's really far away, but they have their own entire cafe in the basement. And so that's where they meet. It's a really cool venue. Also, there is a Monday night Bible study that we have been attending for like 5 years now. Just another mom in the community hosts it. She makes us dinner every Monday. She works full time, but yet she makes us dinner and just opens up her home for moms who are walking this road. It's a beautiful, beautiful thing. So that's what's currently offered, but now we're expanding. So our vision is, it's a beautiful thing, all this is happening at Johnson Prairie Baptist, but what about up here? So this Wednesday, a group is starting at First Redeemer, led by Sharon and Bill Hamilton. And this is the book that I was talking about, The Prodigal Parent Process by Douglas Weiss. Highly recommend it. Anyway, they're gonna start Wednesday nights. If you're interested, you'll have my number and contact information. You can let me know and I can get you connected with her. And then Pacer and I are gonna start this book study at Bronzebridge Church on Sunday mornings. February 16th is gonna be the start date. It will be limited because it's a smallish room. So we do need people to register and let us know if they're coming. And then North Star Church in Kennesaw, a lady reached out to me who had attended some of our groups, and she's gonna start a class there. So we're just trying to expand it. We want every parent who's hurting to be able to access just a group to know they're not alone. So that is that. This is super exciting. So we talked about how we have a daughter as well. She does not have addiction issues, but she's going to school right now to be a counselor. And that's her on the bottom, Elaine.
Pretty proud of her, because, yeah, well, she wants to do family addiction type counseling. So she's basically where I started talking about how God allowed us to go through this, and I'm so proud of her to be able to come up the other side and say, I want to give back. And so she's becoming a counselor to work with families with drug addiction. And in the process, what's the other girl's name?
Abby.
Abby, yes, they decided that they wanted a sibling support group. So they went with SOS. It's just
supporting our siblings, yeah. So Abby, it's a really crazy, just God is always in all the details. So Abby, Pacer and I also facilitate a group called PAL, Parents of Addicted Loved Ones. This meets at North Point Church, and we just got it expanded to Brownsbridge Church too. So it's gonna start meeting there on Tuesday nights. But Abby had come to one of our groups months ago. She had a brother who was battling addiction. And anyway, fast forward to about a month ago, the pastor at Brownsbridge connected me with Abby, and we realized, oh, we already know each other. So we met for coffee, and I brought Elaine, and that's when this whole group just was born. Abby lost her brother in November. His name is Philip. And she just was so overwhelmed with the fact that these siblings don't have anyone to talk to. I mean, they're going through as much, if not more, than parents, because they watch their parent go through torture, and they also like lose their sibling. They don't have their big brother, their big sister, their little brother, whatever. So they need support. And so anyway, it was really cool just to see them get excited about offering support. The first group is this Wednesday, and it's Zoom. So I think that's really amazing. Because siblings, I think, don't want to get the support. They just don't want to do it. They don't want to deal with it. But with the Zoom, at least they could just close the computer if they weren't feeling it. You know, it's a little less, I don't know, in your face. But if you know any siblings, all they have to do is email Elaine or Abby, and they'll give them the Zoom link.
And we can get you that information.
And I'll get it all out to everybody as well. So something else we do that we're really passionate about is community events. We want parents to know they're not alone. So this past September, we had, for the month of recovery, we just had to get together at Pop-In. We catered Los Rios, had the football game on. We didn't have an agenda. We just wanted parents to come and get together and see that, you know, there's community here. We love you. We don't have to be ashamed. So
you can actually see some men in the photo, which I've learned that I just don't support groups and things like that. I have trouble with, you know, it's not easy. So for just to have no agenda, just to show up and talk, and not have to talk about it if you don't want to, but have the opportunity was something that makes a lot to me.
And you had the football game going, so the man could watch football.
That's right. We tried to make it so low key. Just come, just show up. Okay, another thing we do is we have retreats for parents. So we talked about, we've already had the 5 through Sunrise Parent Retreat, but we're about to have our 6th one, but it's no longer Sunrise Parent Retreat. We're now operating under Prodigal Child Ministries. The true retreats are free to parents. We raise the money in the community. We've actually applied for a SANI EMC grant, so I'm waiting to find out if they're gonna fund this retreat. But we also go into the community and ask businesses, we tell them about us. We say, look, we're having retreats for parents. Do you want to show them that you support them? Let's show them that they don't have to be ashamed. Their community sees them and loves them and supports them. And so we have some different businesses that give gift cards or give date nights, and we get to give those out at the retreat, which is really cool. So our next retreat is February 7th through the 9th, and we're having it at a new venue. We've never had it at before. It's called the Ark on Lake Lanier. And it's a beautiful, huge home on the lake, and it's got a cool story behind it too. You'll have to look it up and just read their story. But we're really excited about that. It's pretty full. Yeah. There might be room for like one single parent, but we pretty much have it filled up for this one.
And that's my favorite. Really gets a chance to know good folks like Carl sitting there, to know the men on the other side of it. The ladies can get together, but it's a chance for us, really men or couples to get together. And it's not just couples, sometimes we have singles, but
Yeah.
Marriage is tough. I learned that much
Mhm.
going through addiction issues. And so the retreat gives you a chance to rest, refocus, and refuel, we say. So there's not a lot of agenda. There's a little bit of education. We also give them a chance to just rest and remember each other.
Yeah, like remember, we used to have fun before our time was consumed by fixing our child, you know? Yeah, my favorite part, and I'm glad you said that, my
Yeah.
favorite part of the retreat is Sunday morning. We invite someone in recovery to come and sing, share their testimony. So we still need somebody. If any of you know anyone that loves to sing or has a story to share, we need somebody for Sunday, February 9th.
And it's a good morning. We invite everyone who's been at the retreats to come back.
Yeah.
And so the group just grows and they get to see the love and the support and build a network.
Okay, so let's dream a little bit. These are kind of our dreams for Prodigal Child Ministries. I really want to be able to raise enough money to send parents for counseling. Parents don't go get counseling. They're too busy taking care of their kids. They need counseling. And so that's one of my dreams, is that we'll be able to help fund that. We want to have at least 2 retreats a year. So we're hoping for that. Right now we're having about 1 a year. I really think it would be beautiful to get our group together and just serve in the community. So I'd love to do it more than once a year, but as we're leading this, man, it's busy. So it's hard to figure it all out, but we want to serve as a group, give back, and then we want to keep our community social events. We definitely have the September one, but I see like game nights. I see just other fun things, way to get parents together. And then, of course, continuing to connect hurting parents to support groups. Like I said, we've got that PAL group that has nothing to do with Prodigal Child Ministries, but we're all about connecting parents to get the support and help that they need. And then what about a siblings retreat? Wouldn't that be cool to get the siblings together, to let them go off on a retreat and just really see that they're not alone and that they can get through this too?
Julie spends a lot of time with phone calls. The website generates a lot of interest in facilities, questions. Parents usually, probably, like I said, first time going through this problem. So that's the other side of what we do. I just want to mention that before I forgot. Yeah.
Oh, and then the last thing we didn't say, all of the donations that we receive, we do give back 10% at the end of the year. So this is our first time doing this, so I'm getting ready to look at the donations, and we get to choose different recovery centers or different just treatment centers that we want to support. So we're going to be giving back 10% of all of our donations as well.
Things like that.
Oh, yeah, we do have, if anyone's interested, we have our newsletters that we just did in November. We brought a few, feel free to take one. The board members are listed on there, but we also are just getting ready to add some more board members. Oh, thanks. There's only 10, but so, I mean, if you want one, I do have a business cards too, but do y'all have any questions? We're an open book, so yeah.
So I Live Life serves a lot of people in a day. And so if people are interested in doing, is the best way just to go to the website, or what is the best way for me to connect parents with you guys?
Yeah, they can go to the website. My email's on there, my phone number's on there. And also on the website, the new support groups are listed if they're interested in one of those support groups. The ones at the 3 churches, those are listed. I need to add the, also Facebook and Instagram is a fantastic way to get them connected with information, because we try to always put stuff out there.
Okay, thank you.
Yeah.
Any other questions?
I can tell you personally, we can speak for it. We were at the very first one. My husband didn't want to talk about it. It was his kids, and I didn't think he'd go. And to hear him open up was amazing. That made our marriage better, just to hear my husband actually open up about his kids and admit that we were going through addiction with them. So
it's hard to talk about. It's hard to admit. It took me about 7 years to want to really talk about it. So it's hard.
Yeah. Lifetime friends for sure.
For sure.
Well, part of what the council does and what we do also is just to, I think we just have so many wonderful resources in Forsyth County, and people like you guys really are just so appreciative to have that. I mean, I'm curious, by a show of hands, who in here did not know about these resources? Yeah, so I'm like, I do think a part of what our responsibility is too, and all of us on the council, is to just spread the word, you know, because I don't know how many people know about sibling options. It's phenomenal, you know, and just all the things that you're saying. And so just to say this, you know, they'll give me all their information and we can put all of that on our website too. But just for all of our organizations, if you're running into parents or siblings or anybody and you forget about what you heard in the meeting, you can always call me and I'll direct you to them. We put out a member list by the end of this month that will have all of our speakers, everybody in here's names, phone numbers, and what they do. So you should have a member list as well. We have a resource guide, and on our website, the forsythcountycounselor.com, we have a resource button that will also have all of these. So if you can't remember, you know, what you heard or how to get to it, and I send it all out in an email. We do lots of things to try and get it out, but you know, there's just a lot out there. Always remember on our website, we'll have everybody that comes in to get them to the people you're talking with. So just to say that as well.
Well, and I just have to say, because my kids both went to Forsyth County Schools, we would love to be a resource for parents. Like, we would love that, because well, honestly, we didn't want anyone to know, so we didn't really talk about it, but
when we
if
did,
there's
the
a
school
way-
system was very good.
Oh,
It
phenomenal,
was
yeah,
unbelievable, so.
yeah.
If there's issues in school.
Oh, yeah.
With it, so.
Our son was supposed to go to Gateway, and I was like, no, we're gonna do this. And I was still in the saving mode, but honestly, like, I think Gateway is it's a really good thing for some kids, and probably would have been good for my kid.
Yeah, it's definitely a tough stigma to that.
It's hard,
Yeah.
but thank you for inviting us, and thanks for that stuff.
And on that note, we about reached the top of the hour. Unless there's anything else anybody wants to say, we can adjourn this meeting. Oh, Nancy?
We have another grant that we've got, called COSAP grant. It's from, the, CJCC, which is the Bureau of Justice. And we thought that we were going to be able to use, it's a medical assisted treatment for opioid addiction. We thought we were going to be able to use our people referred by our drug court, but now we've been informed that we can't. So we had in the grant that we were going to take referrals from any of the nonprofits. So anybody that is looking for free medical assisted treatment for opioid addiction, Georgia Highlands is heading up the treatment, and they also have a free counseling program that goes with the treatment. I know it's sometimes not popular, but it is a form of medical, it is a form of a treatment for opioids, and Georgia Highlands will be heading up that publicity and everything, and it's set to start in about a month. So Georgia Highlands is right next door to the accountability courts, which is right down Triple Road. So it's right there. I'm sorry. Triple Road. So it's
right by here.
Is it inpatient treatment, or do you know any details about what treatment you're talking about?
I think it's not housing, residential housing, but it is, you know, you can go there and they have counseling programs. Here they have one-on-one, and they have group counseling. So you go with the mental assisted treatment.
Is the MATD from morphine?
I think it's Vivitrol, and I think there's another one too, but I'm not sure. They are
Wait, and it's already started, or did it start?
they were getting the counseling program started. They had some problems over Christmas break. But I thought she told me yesterday that was within a month.
Okay.
They would be ready.
Okay. Does anyone here know of a, like right now, a program that's doing medical detox of opiates in our county for low cost? Like I sent one yesterday to Gainesville, but I didn't know. I was like, maybe someone knows.
So our accountability course was sending some people, we were having to send people all the way downtown, but now they are going to be able to go right
store, you know. right
But
there.
it's not inpatient, it's, right, it's like they get it and go home, that's what, so we don't have,
Anything in our community.
okay, that's what, okay.
Dahlonega,
Okay.
Roswell, that's. where
Just wanna
people
make
do
sure,
that.
since I didn't know by y'all, I'm like, just making sure, cause I'm
We have
sending
never
people
done
far
it
away.
In our county, no.
Okay,
Yeah.
okay, thank you.
Anything else we need to discuss? All right, ladies and gentlemen, meeting adjourned.
You did also.
No, we took Sarah.
Well, the way that it works, yeah. And it's, it'll start. I mean, they'll start now, they'll be. By April. They will be full on, yeah.
We never get it as quick.
So, yeah.
Yeah.
6 years, I mean, he was at it previously, and then he was there when the. Next year, left, he was there like 12 months. Anyway, he left, and then
So I found out that due to a clerical error, there's an extra day.
Yeah, I was like,
It's kind of out of the. Yes. But it looks okay. Yeah, Sophia's supposed to go out.
Oh, I love that. I used to be. Yeah. But I am definitely. Yeah, I've only been here since May. I really enjoyed it. It's on the back. I work at the. So that's But it was really nice to be here. Yeah. So both of them, you want to if you can see them both.
I saw someone here. Ice cream. Some story there, like, I don't know if that, if they just drove really slow, had a short drive over here. Or they got as your leftovers, like, right on your windshield. Yeah.
Oh.
As an option for what?
Yeah.
Justin.
She's also.
I'm batting, you're batting 1,000, you're batting bad, so I'm batting 200. I got Carl out.
Be able to swing it.
I didn't know until last night that it was on Tuesday morning.